There's a growing need to treat people struggling with mental health issues. Some cases are more complex than others, and local jails are not immune.
Jail administrators with the Erie County Sheriff's Office tell News 4 Investigates there is a real need for more forensic mental health beds at a local hospital. As Luke Moretti reports, any expansion is going to require funding.
Jails weren't built for to be mental health providers, but we're doing the best we can.
Michael Phillips is the superintendent of jail management in the Erie County Sheriff's Office. He oversees both the holding center in downtown Buffalo and the correctional facility in Alden. He says about 60% of the people incarcerated are being treated for some type of mental health issue.
All people that have a mental health condition who are incarcerated deserve quality access to mental health treatment.
And that begins with the agency's intake procedure and screening process.
What does that consist of?
It's asking them questions about their, if they have any mental illness, if do they have any feelings of shame, or, how are their families feeling about their situation. It's a very in-depth screening.
Sandra Amoya is First Deputy Superintendent for Compliance in the Jail Management Division of the Erie County Sheriff's Office. She says if it reaches a crisis point, one option is Erie County Medical Center's secure 9th floor unit, where the Sheriff's Office has 2 dedicated beds for forensic mental health treatment.
Many times there's a waiting list for those 2 beds.
And if that happens,
that we have to wait, for someone, so we have to maintain them here and at the.
How do you do that?
With a lot of therapy, maybe changing their medications, constant observation. We have to put an officer in front of their cell on constant watch. Every 15 minutes, they're logging their every movements, whatever they're doing.
We're the primary intercept point for a lot of these folks that have these issues.
Thomas Dina, Chief of Community Reintegration for the Sheriff's Office, says correctional facilities as a whole, including Erie County, are adapting as more and more complex cases land at the doorsteps of jails.
I started 23 years ago, and the type of folks that we are getting in custody today are much higher need than it was when I started.
A needs assessment study is now underway in Erie County. Among other things, it will examine the county's aging jail buildings, which administrators argue lack needed office space for mental health providers and civilian partners. Beyond that, the Sheriff's Office would like to see more forensic mental health beds at ECMC for incarcerated individuals requiring hospitalization.
You see a need for more beds over there?
Yes, there is a need for more beds.
How many more?
I would, it's safe to say maybe like 6 or 7 more beds, for.
In addition to the 2 already there?
Correct.
In response, ECMC released a statement that reads in part, the hospital would need additional resources to expand, as well as increase reimbursement for the level of care these patients require. We look forward to working with the Sheriff's Office to identify these resources and expand services.
Have you asked for more beds over there?
We have meetings with ECMC, and we have expressed that there is a need for additional beds, but right now there's any funding or whatever for that.
According to ECMC, the hospital and Sheriff John Garcia's office work closely together on a regular basis to treat incarcerated individuals that become patients, adding that the hospital recently became aware of the Sheriff's Office desire to expand patient beds in the secure 9th floor unit. Luke Moretti, News 4.